There we go. Okay, so welcome to the officer training session today for Health Ministries. Make sure you are in the right session. Of course, and Possibility Ministries is going to continue this afternoon from 1 p.m. From 2 p.m. So where are we? I got to know you. Thank you very much for introducing yourself earlier. And it is wonderful to see how many are interested in health ministries and have a passion for health ministries and sharing our wonderful health message. And as Ellen White said, the health message is the entering wedge to get to know people. Is the one thing that we are still able to talk about in a time when political correctness is going wild. We cannot really talk very freely about what we're about, but the health message is still there for us, and the health message is giving us the opportunity to get to know people, to forge relationships and collaboration, and to still talk about our gospel call. And this is a wonderful thing, and this is why I believe in the health message. This is why the health message matters. Who am I? I've already introduced myself a little bit. I'm Beatrice Castrati. I'm a medical doctor, and I also have a master's in public health from Loma Linda University. I've been in the UK for 3 years, and I hit the ground running during the pandemic. But I'm available, of course, full-time at the NEC and also for community services and Possibility Ministries. I'm very happy to serve you in any way I can. And you're always happy to contact me. My contact data and details are on the website of the different NEC departments. So either on the community services page or the health ministries page. It's very easy to find. Obviously, the official way of communication is email. Like this, I will always have a record of what you said to me, and I will be able to find it and refer to it. I am available to some of you on WhatsApp, of course, and you can always join the Health Ministries WhatsApp group. However, I do not check WhatsApp very often, and it's not the official way of communication. So please email or call me directly. Thank you very much. I do want to start with what I always start with. It is my favorite concept, and it is the ground and the basis of everything that we do. we when we talk about health ministries and about health evangelism, we usually talk about a big to-do list. We have plenty of ideas. I want to start a knitting group. I want to start a community cafe. I want to do more health ministries. I want to go door to door. I want to do so many different things. And usually when we have these ideas, that is a great thing because it shows that we're passionate, we have enthusiasm, and we do want to share the gospel, which is great. However, we do need to lay the groundwork for all of that. And this is why I will introduce you to the Golden Circle. I introduce all my officers to the Golden Circle, and I can only encourage you to go through this little exercise with your churches and with your teams as well. The Golden Circle has been developed by Simon Sinek, a business person, businessman who's not Adventist, but the Golden Circle is pretty much universal wisdom and is also open source. What do we talk about? So here, the Golden Circle on the outside starts with what. Every organization, we know what we want to do. We have a big to-do list. We have a list of ideas. And normally, this is how we work, right? For church, what we do are our campaigns and the events. What a person personally does is usually our job title, our job role. This is how normally we define ourselves. But more important than the what and more important than our simple to-do list is the how. But of course, the what is expressed in our mission statement. So our mission statement is basically our to-do list. It is a way to express to the world what we want to do. So the Health Ministry's mission statement, UK-wide, is to encourage and train the membership to embrace healthy lifestyle choices in a holistic approach to well-being that is balanced and evidence-based. And through the promotion of optimal health practices, members will experience abundant living and will be better able to share the message of health, hope, and healing with others. Apologize for the little typo here. This is the mission statement. If you don't have a mission statement for your department or for your church, make one. You need to know what you want to do. And it is not just a list of ideas. How is that? So let's go to the how. The how is a very important concept because the how makes us special. It sets us apart from others. Because, all of the ideas that we have, lifestyle choices, exercise, encouraging people to be healthier, to embrace a plant-based diet. All of these things are not anymore very special because everybody else is doing the same thing. You go to the NHS website, you have the same lifestyle advice. You go to any fitness studio, to any other community group or entity out there, everybody is giving the same advice because the health message is not rocket science. And it is actually quite popular now, and more people are embracing a healthier lifestyle, which is wonderful. So what is different about us? What do we have to offer that is not exactly what everybody else is doing? And this is where the how comes into play. We need to know and how to communicate our special health message. And that means we have other things to offer than just good ideas. How is another part of the mission statement. Okay, it makes it special. It tells others what we are as Adventists. So let's look at the again at the Adventist Health Ministries mission statement, how it goes on. The Adventist Health Ministries mission statement further states, in responding to circumstance where individuals experience infirmity of body, mind, or spirit, we seek to foster an approach that is compassionate as we serve others with the humility and love of Christ. Here we have very important keywords. We have compassion, we have humility and love. These are values that are important, and these are values that make us different, that make us special. When we go and we see other entities giving health advice, we don't often encounter a lot of compassion, but we encounter, well, I am better than you because I'm healthier than you attitude very often, unfortunately. But we embrace a person because our approach is the passion for the gospel. We are trying to embody Christ's love, and we are trying to follow in his footsteps as he was preaching, teaching, and healing. So of course, we are special because we are Christians and we are Adventists, and we have compassion for everybody who needs Jesus. Our programs are not lifestyle centered. Our programs are Christ centered. Our health message is not our religion, but our religion is our religion. Our Adventist faith is our religion. And yes, we are glorifying the Lord through a healthy lifestyle. But the healthy lifestyle is not the means to an end, but the health is not the end in itself, but it's the means to salvation. Of course, a healthy lifestyle is how we are glorifying God through our bodies as his temples. And this is what sets us apart to others. So the most important question that we have to ask ourselves is not just what we're trying to do and how we're doing it with compassion, humility, and love, but why we are doing it. And this is where the whole basis of the golden circle comes in. Many people don't really know why they're doing what they're doing, but the why is so important because it is the purpose of our mission, of our work. It's the cause, and it's the basis for our faith that drives us. The why inspires us. The why shows our values. And the why is the basis for our lifestyle choices. Why are we showing compassion and love and humility to others? Why are we encouraging them to follow a healthy lifestyle? Because we care, because we have a great commission. We have the mission set by Jesus Christ himself to bring more and more people to his throne of grace. We are empowered by the Holy Spirit to spread the gospel. This is why, and we have a responsibility here on earth to help people achieve holistic health, maximum contentness and happiness and spiritual health as well. The why is the basis and the purpose and the cause of everything that our programs do. Now, the why is expressed not in the mission statement, but in the value statement, because the why shows us why we're doing everything. It's our inspiration. So let's look again at the mission statement where the values are expressed. Reaching the whole person by encouraging fitness for life through healthy lifestyle choices in a holistic approach to well-being that enables all to become a healthful witness to the communities that they serve. Values are so important, and without the values, without understanding why we're driven to this ministry, we cannot do it. So I encourage all of you to really go through the why and the how and the what before you start a program, before you start even planning, because we need the clarity of why. Why is it important what we're doing? Excuse me, the discipline of the how, and only then we can answer with consistency what we want to do. Now, I do want to have our first little exercise and our first little break. I'm aware that many people have joined since we started 15 minutes ago, so welcome to the newcomers. Again, just very quickly, we have started recording the session. You're not required to keep your camera on. You can keep it off for the time being. At 11 a.m., we will be joined by two very special guests of the people we are collaborating with by the Blood Donation Service and the Public Health Office in Birmingham. And those people are not Adventists, and I'm very, very happy that they have agreed to join us. This is our chance to witness. This is our chance to show what the Adventist Church is doing and how we're doing it and why we're doing it. And I do hope that at 11 a.m. We give them a very special and warm welcome. There will be a very short Q&A session after each of their presentations, but of course I will be able to answer way more questions in the end, and also later on through email or telephone if you do want to contact me later on. But let's start our little exercise. I will share a worksheet with you in the chat, and you can go through that worksheet, but I will also put it on the screen, and then I will pause the recording and we can have a little bit of a discussion about our values. We do want to define our core values, to find our own personal why. And the worksheet will be also distributed later on as handouts. And I, again, strongly encourage you to go through this with your churches and with your teams. So this is what you're going to see in the chat, a list of random, beautiful values there. And it would be great if you could share them with me later on in the little discussion. And let us find 5 values. Let's focus on 5 values that resonate with us, 5 values that we identify with, that we feel is the basis and of our ministry and our passion and our inspiration. And then we can talk a little bit about this and maybe write our own value statement. So I'm going to stop sharing now and put the exercise in the chat. And I will give you a, let's say, 5-minute break, and then we can reconvene in 5 minutes and have a little discussion. And I will and I will start again, share the screen. So here's the values that we were looking at just now. And what we also need to do is then to find clarity. So now we have the clarity of the why. And again, Sister Campbell, wonderful. You have given us your clarity of why you're doing what you're doing. And of course, yes, the discipline of the how. We have to be consistent. This is where integrity comes in, and only then our what, our activities align with our values. And that is wonderful. And I'm very, very happy about your findings and what you talked about just now. Now, it doesn't stop there. There are plenty more exercises out there, and if we have time, we can do a couple more. But there's more. We need to empower our team. So I'm very happy that I heard the value teamwork earlier. This is important, and you need to know who to get into your team. Your team is your basis. You cannot do anything on your own. So it is important to gather a team around you that can help you, that can encourage you. But you need to know who to give what. Okay, not everybody in your team does have to be a health professional, by the way, because again, a healthy lifestyle is not rocket science. Anybody in the world is equipped already by the Holy Spirit to make the right choice. So equip and empower your team with a value statement that you've just done. They need to know what their interests and their passions are. Of course, you need to know how much time they have. And there are plenty of exercises out there they can do. And there's only a few that I'm naming. There are way more. Of course, there's a resource assessment. You need to know who in your church is available when, what they can do, what is their passion and their gift. And then you can assign who does what in the team. A strength assessment. That's a good thing to talk about. What I am good at, to really think about this. A strength assessment is very good for young people to complete, because especially young people need to be encouraged. Usually young people are told what to do, but nobody really tells them what they're good at. But encourage your youngsters in your churches and tell them, you know what, I really feel that you have a gift. You have a friendly face. You could be inviting people in. You could be bringing people to the programs. We need you to help us and to support us. So it is a wonderful idea to do a strength assessment with your youth group. And then, of course, the spiritual gift survey. The spiritual gift survey is a small test that might nudge you in the right direction. Some of you mentioned you didn't even know what your gift was. I did the spiritual gift survey yesterday in Wensbury Church. And many people came forward and they said, I didn't know that that was my spiritual gift. So it's always good to think about things and to establish what you are good at and what talents the Lord has given you. And then you can go forward and just go for it and just reach out to the public. So do your assessments, build your team, building your team, and having a community is so important. The church board must be behind you, what you're doing, of course, and your church must embody what you preach as well, because in the end, what do we want to do? We want to bring, of course, the health message to the people, but we also want to make disciples and bring people into church. And when they see that the church is very different from what they have learned outside in the health expo, then we don't achieve the integrity that we meant to achieve. So this is something that we have to think about. Now, I do want to move on a little bit, and I want to share with you that it is always important for you as new officers, and of course, seasoned and veteran health officers as well. And it's always good to check back with the Adventist General Conference Teaching of Health Ministries. You can just check on their website as well, healthministries.com. And it's very, very important to keep yourself informed. So in 5 minutes, hopefully, if they join on time, we will receive 2 guests that we're collaborating with. And why are we doing this? I will tell you more about our project, but recently we have won a project, a large project from the NHS. The NHS has awarded us quite a bit of money, about £20,000, to empower us to do what we are already doing: health expos and health education programs. This money will go into resources, of course, in buying more resources for blood glucose testing, blood cholesterol testing, new banners, better health expo kits, replacing what must be replaced, printing more brochures, ordering more literature. So all of this helps us with equipping you with more things. So this is wonderful news. But of course, it is important that we collaborate, that we work together with other community organizations. This is our chance to witness. We're not just witnessing to the people on the streets, we're witnessing to other health professionals. This is about raising the visibility of the church. How are people supposed to know what the Adventist Church is all about if we don't tell? As I was applying for these funds and I was writing the project, I listed all of the things the Adventist Church is doing globally and UK-wide, and I was impressed myself just realizing that globally and UK-wide, the Adventist Church is the only church that is so invested in health, in physical health on this world right here where we are in the present. And this is wonderful for me to know that we actually care, because this shows us how we're embodying Christ's teaching. And I'm very, very, very proud that we do have the chance to share this message with others. So we're going to hear from the blood donation service. Ash is going to join us in a little while, and he's going to talk about blood donation and sickle cell anemia, which is very, very important. And I would like you to encourage your church members and your brothers and sisters to donate blood, because it is the right thing to do. But Ash is going to tell us more about it. Now, the good thing is, if we do register, we will be awarded for every 50 registered blood donors, we will receive a free first aid course. Oh, okay. Ash is already online. Wonderful. And after Ash, we're going to get to know Funmi. She is going to talk to us about a very important update in a measles outbreak in Birmingham. But before we welcome our guests, let me just remind you that we as the Adventist Church, we are supporting responsible immunization and vaccination, and we're supporting blood donations. So if there are any questions, you can direct those to me, but this is what we globally and from the General Conference support. All right, so let me stop sharing my screen and welcome Ash Ramnavas. Thank you very much for joining us. Can you show your face to us, please?
Yeah, sure. Bear with me one moment.
Hello, how are you? I think you're able to share your screen as well. Hello.
Everyone. Hi. I hope you're all okay. So I am Ash Ramnawaz. I am part of the marketing team with NHS Blood and Transplant. I hope you forgive me today. I'm not feeling very well, so just bear with me while I run through this presentation. And with me is my colleague Cynthia, who I will let her introduce herself. Yeah.
Hi, Cynthia. Hi, Ash. Welcome.
Morning, everyone. My name's Cynthia.
Very, very welcome. And thank you for joining us today.
Thank you so much for having us. We are here to talk to you about blood donation. So I'm just going to share my screen, if that's okay. Hopefully this works. Sorry. I'm a bit slow. It's a Sunday morning. And
we're all in the same boat.
And just let me know if you can see my screen.
I can see your screen, yes.
Perfect. Okay, so we are NHS Blood and Transplant, and we're going to talk to you a little bit about who we are and what we do, and some of the people that we help. So we are the providers in England of blood, organs and tissue and stem cells in England. So we actually have 28 blood and plasma donor centre and 15 mobile teams to help supply blood. We supply over 1.4 million units of red blood cells and over 250,000 units of platelets and 200,000 plasma components for transfusions to over 260 hospitals. Myself and Cynthia are mainly part of the blood team, but we do also sometimes work with organ donation, platelet and plasma donation. We also have 12 regional organ donation teams. We currently have 4,000 life-saving organs to 29 UK transplant centres. And we also have 14 centres with manufacturing, pathology, donation and other specialist facilities. So, like I said, mine and Cynthia's main focus is blood donations. Why it's so important to donate blood is because every time you donate blood, you can save up to 3 adult lives and 6 children's lives. Currently, there are about 55 million people living in England, and 5,000 donations are needed every day. It might interest you to know, however, that only 3% of the eligible population actually donate blood. I don't know if any of you currently donate blood or if you know someone who donates blood, but it's not quite as high as we would hope. Around 1.4 million units of blood are issued to hospitals each year, which are needed for transfusions to people with blood disorders or trauma emergencies during childbirth or during surgery and in cancer treatments. We need more than 475 new blood donors every day to meet the needs of hospitals. And in the next 5 years, we actually need up to 1 million more blood donors. Blood can only be stored for 35 days, which means there is a constant need for blood donations and for specific blood types, which is why we always encourage people to sign up to give blood. So there are 8 main blood types, some rarer than others. And each blood type is used for different reasons. So O positive is the most common blood type. 1 in 3 blood donors are actually O positive, and around 35% of blood donors have this blood type, which is why it is one of the most highly requested in hospitals. We also try and match blood by subtypes, which is why the need for rarer blood types is becoming more prevalent. So, yeah. I'm now going to hand over to my colleague Cynthia, who's going to talk to you a little bit about sickle cell. So, Cynthia, whenever you're ready.
Good morning, everyone. Hope everyone's doing well. I'm pretty sure everybody in this Zoom meeting knows someone that has sickle cell. So I'm just going to explain what sickle cell is. Let's try and make it as simple as possible. So sickle cell is a type of genetic condition that affects the shape of red blood cells in the body. Normally, red blood cells are round and flexible, but with people that have sickle cell, they become shaped like a crescent or sickle. This can cause them to get stuck in blood vessels, leading to pain, such as which is called sickle cell crises. It can also cause infections and other serious health problems. People with sickle cell experience literally extreme pain, and it can cause difficulty in normal daily activities. It's a long life condition. So yes, blood transfusions for people with sickle cell. So these patients, majority of them, not all, need regular blood transfusions or exchanges every 4 to 6 weeks. And because they have it so regularly, it's needed from people with similar backgrounds. This condition, there are people from different backgrounds that have sickle cell. So I've seen Mediterraneans, Asians, but it is more common in Black, African, and Caribbean backgrounds. Next, please. So yes, we are asking for, we don't have, I believe there's only just 1% Black people, Black, African and Caribbean heritage ethnicity that are donating. So we need a lot more people from that background donating. So I'm not going to read straight from this presentation, but I'm just going to try and make it as simple and easy for everybody to understand. So a patient that needs regular blood transfusions, if they are not getting if it's not matched, it's going to make it difficult for them to, it's going to make it difficult for them to be transfused when they need to get it again. So that's why we need it to be as matched. The blood needs to be matched as much as possible, or they'll get antibodies. So at the moment, we urgently need 17,000 new Black donors. Roughly, people with sickle cell, and I think this number is actually growing. At the moment, we have between 12,500 to 50, I believe it's gone up to 16,000 people with sickle cell. Not every person with sickle cell has blood transfusions, but at one point they may need it, and you can't just transfuse them with any blood. It needs to be matched as much as possible, or it's going to cause a lot more problems for them in the future. People that do with sickle cell, what it does help them have less crises. So that's why it's really, really important. Have I mentioned everything? Yes. So here's just a quick video for everyone to watch.
I hope the sound works on this, so just let me know if it doesn't.
Living with sickle cell is challenging, and so often he's in pain. So the last transfusion he had was 2017, which he had to be in intensive care for, and the transformation from the whole process, which is amazing to see how he got back to his usual self.
Sickle cell pain usually lasts anywhere from like 2 days to about 2 weeks or longer. It feels like glass breaking inside of me.
I'm Kehinde Salami. This is my daughter Angel Salami. We both have sickle cell disease. A few years ago, Angel had a first blood transfusion due to a sickle cell crisis. For me, it was heartbreaking. I'd never seen her looking so weak. She had to be rushed to hospital to have an emergency blood transfusion, which was very scary. And if it wasn't for that blood transfusion, she wouldn't be here today.
Sickle cell affects mainly people of Black heritage, and we need more Black donors because they provide a closer match for people like me that need blood.
You're more likely to receive a blood match from your community than from a donor that's not within our communities. We do have that special type of blood that matches us. It takes one donation of blood to actually save up to 3 lives. So I will encourage more people from our community to give blood and to know that their blood donation is going to the right place.
The whole process was pretty easy. Basically, I just walked in and then I sat down, they gave me a drink, which is nice. And then after that, just started the donation process.
Giving blood is so quick, so easy, just do it.
Thank you for that. So in that video, I know one of the two of the patients, Kenny and his daughter. So I've worked with Kenny. He also does this work as well, and I've just seen how he's been in pain and just sometimes just being so helpless. But I would definitely encourage everyone if you can please donate. It's really quick. And an easy thing to do. Do you want me to do this one, Ash?
Yes, please.
Yeah. So yeah, if I'm hoping I've encouraged people to, we've encouraged you to donate. So these are our permanent blood donation venues: West End, we're at Shepherd's Bush, literally everywhere. We have one in Birmingham as well. I don't think it was written here. Luton, and we also have pop-up sessions. So these are the permanent ones, our clinics, but we also have pop-up sessions all over England. Do you want to go next one, please?
I'll take over this one. So a lot of people don't actually know what will happen during their first donation. It does sometimes cause some hesitancy if you don't know what you're going to be going through when you go for your first initial appointment to give blood. So this is just a video that will talk you through the process of what exactly will happen when you do go to give blood for the first time, and hopefully it will put you at ease, because all of our staff are really lovely and they will make sure to take care of you.
Making an appointment is the best way to arrange your donation, as it's easier and will save you time. Before you give blood, you should eat regular meals, drink plenty of fluids, and avoid any vigorous exercise. We aim to ensure that your whole donation journey lasts no more than 1 hour from your planned arrival time. When you arrive, you should give your completed donor health check questionnaire to the receptionist. You'll be given our welcome leaflet to read, as well as 500 millilitres of water to drink, which will aid your well-being during and after your donation. When your name is called, you'll be taken for your private health screening. You'll be asked some confidential questions, and your hemoglobin levels will be tested. This only takes a moment and is done by taking a small blood sample from your finger. If all is well, after a short wait, you'll be invited to a donation chair. A cuff will be put on your upper arm to maintain a small amount of pressure during your donation, and your arm will be cleaned before the needle is inserted. Your donation will normally take around 5 to 10 minutes to complete. Once you reach the full 470 milliliter donation, the needle will be removed and a sterile dressing will be secured on your arm. We'll also give you a card with some important care advice to take home with you. You'll then be able to go and enjoy the refreshment area, where drinks and snacks are available. You should relax here for at least 15 minutes and have at least 2 drinks to stay properly hydrated. After that, you can book your next donation appointment to keep saving lives with your generosity. Book your appointment to donate. Visit blood.co.uk today. Save a life. Give blood.
Thank you for watching that video. I really do hope this encourages you to go and book an appointment. Most people do sign up to give blood, but getting to that first initial appointment is always a bit of a hassle. We do understand that sometimes it is very difficult to book an appointment, and we do try and make it as easy as possible with our mobile donation teams and our donation centres. So when you can book an appointment, please do. It only takes an hour and you can save 3 people's lives in that hour. You can really become an everyday hero. So it is really important. So one of the last slides I'm going to go through is while we do focus on blood donations, there are also other components that you can give. We do have certain criteria to become a blood donor, as well as a plasma or a platelet donor. We ask that you're generally fit and healthy, that you if you have had any previous medical conditions or are under any investigation, or if you take any medication, we just double check this to see if you are eligible to donate. You have to be between the ages of 17 and 65, and that's our general eligibility. We do have a health and eligibility page on our website where you can check any conditions or any medications that you might be on, or anywhere you might have traveled, to see if you might be deferred for anywhere between 4 weeks and 4 months to become a blood, platelet or plasma donor. If you are not eligible to become one of these donors, you can always still give organs instead. Organ donations, they have a smaller criteria, and almost 10,000 people are waiting for a transplant in the UK. So please look into that as well if you can. It is actually a separate registry if you are donating organs. If you are donating blood, you would have to register on blood.co.uk. And we do also have a link for organ donation where you would register your decision over there. And if you are registering as an organ donation, one of the most important things we tell you is please let your loved ones and your friends and family know your decision, just so that at that time that everyone is aware of what you wish. So the last bit is that myself and Cynthia actually work with our partnerships and engagement, partnerships and community engagement team. Sorry, we are part of the marketing team that works with collaborative projects or activities with various organizations. And what we do is we will try and organize sessions where we can do either presentations or recruitment events. If you are interested in one of these activities or collaborations, please do email one of these two inboxes and we will get back to you as soon as possible. We try and reach as many people as possible. If you are based in London, it is the CE and East inbox. And if you are based around England, it's our business inquiry inbox. Just put as much detail in the email of who you are, your organisation, and what sort of activity or collaboration you wish to work with us with. If we don't actually do on-site blood donation sessions anymore, nor do we do group bookings unless it's special circumstances. So if that is what you're looking for, we can look into it, but we unfortunately can't make any promises. I will also be sharing these emails in the chat, so don't worry about that. And that brings us to the end of our presentation. Are there any questions?
First of all, I want to say thank you, Ash and Cynthia, for joining and for giving this very informative info session. So I'm very, very happy to have you here today. Thank you.
Thank you very much for having us. Yeah.
Having us.
Just going to stop sharing now and give you your screen back.
So if there are any questions, just you can put them in the chat or just ask away.
And
Mark, you raised your hand.
Hi, Ash. Thanks for this morning. Very, very inspirational. Both you and Cynthia, thank you. Just wondering, you mentioned at the beginning of your presentation that the number of blood donations aren't as high as it should be. Hypothesize what could be the rationale for that?
There are a lot of different reasons. There are a lot of myths around blood donations. Also, a lot of people don't actually think of blood donations. They do think that if in hospitals, if they need blood, it's there. But I don't think they then go on to think about where that blood comes from and how it gets to the hospitals. So we do try and, spread as much education as possible about blood donation. It is also that a lot of people don't like blood. A lot of people are not fond of needles. They're not fond of hospital situations, unfortunately. We do try and put everyone at ease. We understand it's not an easy process, but we do appreciate everyone who does go on to give blood. And also it is a fact that particularly in minority backgrounds, it's not something that is spoken about. Unfortunately, it's not something that is encouraged. We always try and work with charities and communities of ethnic backgrounds to try and push our message that it is doubly important for those donations, because we do have a significant decrease of the blood that we need from those backgrounds. I hope that answers your question.
No, fine. Thank you very much. God bless you both. What you're doing, great job. Thank you. Keep going.
Thank you.
Thank you. So Brian, you have a question as well, and there's a question in the chat as well. So, but Brian first.
Okay, thank you. My question basically is, I've spoken to a few people with regards to blood donation, and they've been concerned that they are taking a lot of medication already. Does that affect their ability to donate? Because there's some on, regular or chronic medication, whether it's hypertension medication and all sorts. So does that affect? Yeah.
It does depend on the medication, yes. So dependent on the medication, as far as I'm aware, if it's for a condition where the medication is solely treated by constant medication where the dosage hasn't changed, like diabetes, for instance, or high blood pressure, for longer than 4 weeks, generally we do take those blood donors as long as the medication won't affect the blood donation. If they are concerned about that, they can always call up our helpline. I am happy to share that number. It is our medical helpline, and all they need to do is call up the number, mention the condition and the medication that they're on, and hopefully they can advise on whether they can give blood or not.
Thank you.
No worries.
All right, thank you. So there in the chat, there's a question about malaria antibodies. Could you say something about that, please?
So one of the tests that we do is dependent on where you have traveled in the world. We will test for malaria antibodies. If you have a malaria antibody within your blood, we wouldn't generally take the blood in that instance because we don't know how it would affect the person who is receiving the blood, unfortunately. I don't know the entire medical background about it. I don't have a medical background, unfortunately. But if you are interested in knowing the medical aspects of that, again, our helpline would be able to help you. But yeah, dependent on where you live, if you have had malaria, if you have the malaria parasite, you might not be able to give blood in future.
Thank you very much.
So it says here, but he lived in Europe for up to 16 years. It might be that parasite is still within his blood. Sometimes it does go away, and they say if you have had malaria and you've recovered, you can donate blood after, I think it's 4 years. However, if you do still have that antibody, it might be that it makes the blood illegible to be used, unfortunately.
If I can just pop up on that. So someone that's had, if you've lived in Africa, so for example, my background's Nigerian. If I haven't obviously, but if I had lived in Nigeria or, well, majority of my life, I would most likely be getting malaria on a regular basis, and you're likely to have malaria antibodies, and you cannot give that to a patient. So they usually should have tested to see if you have malaria antibodies, and they'll just say, yeah, no. But if you on the help checklist, if you say if you've had it, they tend to turn people away for that, unfortunately, due to, if they know there's no point, it's a cost thing as well. If they know something it's not possible for you to donate, there's no point of us, sticking a needle in you, that the blood's just going to be wasted.
Okay, thank you very much. So if you have any more questions, again, helpline, again, the email addresses are in the chat, and I'm also there to answer any of your questions. Thank you very much, Cynthia and Ash, for joining us. That was wonderful. And I have to show you something. I do have an organ donor card, and we have to practice what we preach. And this is where we are. And I do hope that we have given you some really good information today, practical information to take away. So thank you very much. If there are no more questions, then we can say a very cordial thank you again to Cynthia and Ash, and enjoy the rest of your Sunday. God bless you, since we're at church, and thank you for joining, and we can continue with our presentation.
Thank you very much for having us. Bye-bye. Have a lovely
Bye-bye.
afternoon.
Thank you very much.
Bye.
Bye.
Bye-bye. Whoops, that's not. Okay, I will continue sharing my screen and continuing with our presentation. Just bear with me. I do hope you enjoyed that. And again, it is very important that we practice what we preach, that we show integrity, and that we as a church encourage others to improve and save others' lives. Yes, lifestyle choices are important, but also life choices are very, very important. So around 12 p.m., we're going to be joined by Funmi, who is going to tell us about a measles outbreak that is currently raging in Birmingham. She hasn't joined yet, but as soon as she's online, we will have another info session there. So as I said, it is very, very important to collaborate, because collaboration is what keeps us as a church visible to others, because collaboration helps us to multiply our programs. If we have tunnel vision, and if we say we want to do our thing, then we will not be able to have the reach that we would like to have. This is particularly important when we think about making more disciples, and when we go back to the biblical way, because whoever we're collaborating with, even if they are not Christian organizations, they could be. And the people working for those organizations could become disciples too. And this is why this is important. The underlying question for everybody is, do they need Jesus? If they do, then let us work with them. And if they are not against us, they're for us. And for us, it is important that we share the same values, and that we communicate our values to others, and that we communicate our important message to others. And this is why we have this wonderful initiative, and this is why we're able to share with others. It is important to actually go out of your church and to go out in the communities and to work with people where they are, to pick people up where they are. And that leads me to our next section, the community assessment. Yes, our communities are important. We do want to transform communities with whatever we're doing. And this is important for us, of course. Why are we doing it? Because we have a passion for the health message. We have a passion for healing. We have a passion for a healthy lifestyle. And this is why we do need to work with our communities. I do want to share with you how important it is to do a community assessment first, because any project that is based on assumptions can be doomed to fail. And this is why I would strongly encourage you, before you think of great ideas, how to do health ministries and how to bring the health message to the people, that you actually do a community assessment. How can you do that? Of course, you can go door to door and do a survey. That's the simplest thing. You can look up the demographics of your neighborhood, but you can also head to the council website and check for the JSNA, the Joint Strategic Needs Assessment, and that's sometimes called the Health and Well-Being Strategy. And this is where you will see what is actually needed. This is where you will get to know the cause of death for many communities, which can be high blood pressure, which can be respiratory diseases, which can be cardiovascular diseases. We will later on go and look at one of those assessments together, and I will give you the chance of checking out what will happen, what is happening right now in your immediate neighborhood. But I've just seen that Funmi has entered and she has joined us. So I will stop sharing, and I will give a very special welcome to Funmi, who has joined us to give us a very, very important health update. So welcome, and thank you for coming on.
Thank you so much.
So as we have just talked about what is happening in our immediate neighborhood, I think this really fits right now very well into this very specific context, because Funmi is going to update us on what is happening right now in Birmingham. I had the pleasure of meeting her in a meeting on Thursday. And as soon as I heard her presentation, I said, I need to share this as a matter of urgency. This is something that is happening right now that affects all of us. And this is information that must be shared right away. And who better to share it with than our health officers in the churches. And I know many of you are based in Birmingham, and this is something that you can actually communicate as well to your church members. So Funmi, thank you very much for being here. And you're very happy to take it away from now. I hope screen sharing works for you.
Thank you. I'm trying to do that in the background. But let me just introduce myself. So good morning, everyone. Thanks so much for having me and giving me your time this morning. My name is Funmi Worrell. I am the service lead for health protection at Birmingham City Council. And I'm here today to give you an update of what's happening with the measles cases that are going on in Birmingham, as you might have been hearing from the news. I think for me, it's really important to share an update of where we are with measles, but I'm really keen also to get some feedback and maybe some discussion with you so that I can take back whatever challenges, blockers or anything that we think might be stopping people from getting that MMR immunization. So let me try and share my screen. Should I do it via the entire screen and then just get it from my desktop?
I think it should work fine, yeah, because it worked just earlier as well. Ah, there you are. Okay. Okay, somehow you have muted yourself, but we can see your screen. Okay, there you are again.
So I've stopped sharing. Can you hear me?
We can hear you now, yeah.
But has this screen stopped being shared?
Yes, unfortunately.
Okay. Apologies. I will try once more. I'm terrible with the IT.
Oh, no worries. Who isn't? It's a steep learning curve, actually. We've only just started using Zoom 3 years ago, right?
Yeah, we use Teams, so this is all new to me. So I've clicked on also share system audio, so hopefully that will now work, but let me try again.
So unfortunately, you're again muted, but never fear. I have your presentation, which you shared with me earlier. So because I knew sometimes screen sharing can be a challenge, and I'm very happy to share the slides for you. You just have to tell me when to go to the next slide. Would that work for you?
Let me just try one more time. One more time.
One more time. That's the
Can you still hear me?
Yes, now it's working.
Can you see my screen?
Yes.
Fabulous. Okay, so that's probably the hardest bit over now.
Very good.
Now that I'm showing my full screen, I can't see any hands, so please just jump in. I'd like to keep it quite informal, but I'm just going to go through these slides and then I'll stop sharing, and then I'd really value a discussion. Okay, so I'm here to talk about the current measles situation. I'm going to start with the key messages for everyone in Birmingham. And these are the 6 key things that my team would like to share with everyone. Firstly, and most importantly, MMR immunization provides the best protection against measles for anybody. So it's really, really critical that we share that message, because we are getting feedback where people are saying, oh, isn't it best just to get measles? And the answer to that question is no. And, we'll get to it as we go through the presentation, but getting measles is quite a risky thing to consider for yourselves or for your children. MMR immunizations that do not contain pork are available at all GP surgeries. So you can ask for the MMR immunization that doesn't contain pork. And I think that's really important for some of our faith and other community groups who don't know that there is an immunization that is porcine free. It's important to contact your GP surgery to catch up with MMR immunizations, and this is at any age. So although we're seeing the vast majority of cases in children, if an adult is unimmunized, they're at risk of getting measles as well, and we have seen measles in older people. Anyone with suspected measles should not attend a healthcare setting without calling ahead first, and I'm going to explain why that is as I go through these slides. If in doubt, ensure that you report a potential case to the UK Health Security Agency. So these are our colleagues who deal with cases of measles. So they do what we call contact tracing, they provide clinical advice, and we work very closely as a system with them. So very important that it's reported to them, and then they can take the best possible next steps. And they do that by doing risk assessments and basically considering the full picture. So they must be contacted. And any unimmunized close contacts of a measles case may be advised not to come to school or other settings for a number of days. And again, I'll get to why that is. So just very briefly, just talk about the virus itself. I think people are quite familiar now with outbreaks because of what's happened with COVID, but measles and COVID are very different. We know so much more about measles. So measles is one of the most contagious viruses, so much more so than COVID, than hepatitis, than HIV. It's the most contagious virus that happens in humans. It is transmitted by airborne transmission, so that just means cough, sneezes, those kind of things is how it's spread from person to person. And it is very contagious. So 9 out of 10 unimmunized close contacts will get infected. And by close contacts, they mean usually if you live in a household with someone. But with measles, if you're within close proximity of someone who's got measles for 15 minutes, you can get infected. So the WHO, the World Health Organization, MMR target is 95%, which means they want 95% of the population to be vaccinated. And anything lower than that 95% means the population is at risk of a measles outbreak. And unfortunately, that's what we're now seeing in Birmingham. So MMR uptake. So MMR is the measles, mumps, and rubella vaccination. It is in the routine immunization schedule. So basically, there's a list of immunizations that children should have from the age of 2 months until they're teenagers, and even it goes on to adults, actually, the national vaccination schedule. And essentially for MMR, there are 2 doses given to protect against measles. So the first dose is given at 12 months and the second at 40 months, or 3 years and 4 months. Birmingham uptake is just much lower than what we would like, really. We want it to be 95%, and we're nowhere near that at the moment. And this phenomenon has been happening kind of for all vaccinations, and it's something that the WHO has described as vaccination fatigue. So they know that it's not just, Birmingham, it's England, it's national. Vaccination rates or immunization rates have been dropping. So current situation in Birmingham. Measles is circulating in Birmingham and across the West Midlands, but also across England, London, and also internationally. As of last Monday, there were over 280 cases of measles, and these have been since October 2023. I think now it's over 300. Around half of the cases have required hospitalization, and the vast majority are in unimmunized people. So the median age or middle age, when you line all the cases up from youngest to oldest, the middle age is 6 years. So we're seeing it a lot more in small children, school age and early year setting as well. So the symptoms of measles. Measles unfortunately presents like lots of viruses, lots of cold viruses, and it's like lots of different things. So you get cold-like symptoms, runny or blocked nose, sneezing, cough, red sores, watery eyes, and you can get a very high temperature above 39 degrees. So most people who get it will be very unwell, or at least not well enough to want to, go to school or go to work. They tend to get quite unwell with it. And there is a characteristic non-itchy red-brown rash that usually appears 3 to 5, but sometimes 4 days. And it can start around the ears before it spreads to the rest of the body. The spots may be raised and joined to form blotchy patches. And it looks different on different skin tones. So we do have resources where you can see what it looks like on white skin, on Asian skin, on black skins, which will help to people to see, oh, okay, maybe this could be measles. So what do I do if a child has suspected measles? Well, if they do have symptoms of measles, do keep them at home. And the advice is that parents shouldn't bring their children with measles symptoms to the healthcare setting. And that is because if you are around someone who's got measles for 15 minutes, you then become at risk of getting measles yourself if you're unvaccinated. Therefore, we need to prepare the healthcare settings for anybody who might have measles. So you need to call in advance and let them know. And I think this message has sort of gone through to GP practices, to urgent care centres, to hospitals. So any worries that there's measles, please call in advance so that they can isolate the person and keep other vulnerable people safe. So suspected measles may cause concern. Advice is available on the NHS website, on the UK Health Security web pages, NHS 111 and GP surgeries. So do not go to the healthcare provider, instead call for advice. So what do I do if I have a child that I think has suspected measles, or myself or my partner or someone I know? Well, UK Health Security Agency will support in the risk assessment, and they will advise on what the next best action should be that you should take. And if your setting needs any further support, UK Health Security Agency will work in partnership with our team at Birmingham City Council and with the local NHS. I've got the numbers there for how to contact them. I think they provide a Monday to Friday service, and you can call them on that number, or you can email them on that email address. And I'm very happy to share this presentation afterwards, so you have these details to hand. So just to reiterate the key messages for everyone, I won't go into each individual thing again. I will provide this so you can have a look in your own time. But really, immunization is the best defense against measles. There are vaccines that don't contain pork. Please do contact your GP if you're concerned at all. And then we have key links and contact details that provide even more information about it. And then just resharing the details for our colleagues who deal with any cases of measles. So the question, I guess, to you yourselves this morning is, how can we support individuals to get their MMR immunization? When I did this presentation late last week, I had my colleague, Dr. Shanara Abdin, who is a behavioral psychologist, and she wanted to talk about models of vaccine hesitancy. So we're doing a piece of work where we're trying to sort of understand about vaccine hesitancy, and we're looking into how we can basically link in with all communities across Birmingham and talk about what kind of things are stopping people from getting themselves or their children vaccinated. So some of the things she talked about were the capability, opportunity, and motivation. So do people feel that do they know how and where to get the MMR immunization? Do they know that support is available, etc.? In terms of opportunity, do they have the time to get vaccinated? So should we be coming out to you, maybe closer to the community? And then motivation, does the past experience on getting a vaccine influence behavior? So what are we doing as a team? Well, we're engaging with professionals, community organizations, faith organizations, voluntary and third sector organizations to really raise the awareness, because Birmingham really is currently the city with the most cases of measles, unfortunately. We're supporting a train-the-trainer approach to have discussions with residents, communities, service users, and to pass the message on about the MMR vaccine and signposting to where MMR vaccine and immunizations are available. So my question for you today and how you can support us is if you are aware of any issues from communities from getting the vaccination, how can we help support to get the communities vaccinated or immunized? And if we arranged, for example, a pop-up van, would communities come and take up the offer? Because it's potentially something we could ask our colleagues in the local NHS setting to organize if there was that request. Okay, I'm going to stop sharing now and I'll hand back over to you, Beatrice, just to see if there's any thoughts on what people think we can do to support you.
Thank you very much again for sharing this wonderful and very important update. And again, it is important to understand what's happening around us so we can actually stay relevant with whatever we're trying to do. And I thought it was quite alarming to see that that the hospitalizations with measles outbreaks concern mainly children, and that it can be very, very serious indeed. Now, I'm just going to start out with a question before everybody else will jump on it. Why is it that just undergoing the natural flow of the disease is not as effective or as great as actually having the vaccination? Because a lot of people would say, well, let nature take its course. So what is the argument that speaks against that?
Sure, that's a really good question. And I do have some frequently asked questions that I can put together and send to you where they have a more comprehensive response. But it's essentially this: measles can be extremely dangerous. So if you get it naturally, 50 to 100 years ago, it used to kill a number of people in society. So we don't say that to scare people, but it is a fact that it can be very, very serious. Up to half of the children that are getting it now do require hospitalization, and you can get very, very serious side effects, some of them long-term side effects. You can get swelling in the brain, really serious things. And I think that the data tell us, or the evidence tells us, that 1 in 5,000 people who get it, in those people, it can be fatal. So the vaccine is extremely safe. We've been using it for many, many decades. And we know that there have been some links to things that have been debunked. So I think some people have been concerned about autism. And just to talk about that and to say that that has been completely debunked. It's completely safe, and if it prevents children getting extremely sick or potentially dying, it's just the safest thing to do. So getting it naturally, it's a high risk thing to do for your child or yourself.
Thank you very much. That was very important for me. And also, I have to say, I really appreciated that it's stressed that pork-free vaccines are available, because we, as a faith community, although we're a Christian community, we also adhere to the health advice found in the Bible, which also talks about avoiding pork products or pork. So I'm very happy that this is also available, and that that this is one less concern for our community. Now I want to open this up to the officers here. Do you have any questions? And please raise your hand so we can just get everybody by one by one. So Yvonne, you unmuted yourself.
Yeah. Good morning, everyone. I've just sent a message to Fumi. Have I pronounced your name correctly? Yes, thank you. But I think I might as well question it. I was a lecturer at a local FE college at the time of the scandal with Andrew Wakefield, because I used the article for a public health lecture and some assignments for the students. My concern is, I observed quite a lot of the public, as well as members of my student community, who the parents refused to give their children the MMR vaccine because of the so-called alleged links to autism. Having said that, I later discovered through my own investigation that his article wasn't about the link to autism per se. It was his methodology of obtaining data. And so my concern is the damage was already done. The other thing they didn't do is inform the parents that they didn't have to have the triple vaccine. They could have it singularly. They didn't have to, because in my day, it wasn't available as a triple vaccine. It came out in 1988 because my children had it. So having had measles as a child in the Caribbean, I know exactly what it does to you, because I'm still left with the scars. I'm still left with the damage it did to my hearing. And praise God, it didn't give me anything more toxic like meningitis or any other problems. But my biggest concern is, what are we doing about making sure the outcome of the BMJ's investigation to prove that his research was not accurate? The public haven't had that media coverage, but we had the media coverage that went on for weeks. Everybody knew about it. But when it's rectified, we don't hear about it. It's only because I'm investigating it for my own teaching purposes that the BMJ article came to light. So I do think we have a responsibility, as we had a lot of scandal going around in media. Do we not have a responsibility to make sure the media is portray the correct information now?
Absolutely.
Because if we have immunization hesitancy is not new, because people don't understand how immunization works. And I don't think we do enough to publicize the physiology of how it works. Because if you know how it works, nobody would be scared of it. That's my belief. But having said that, COVID did a lot of damage because of all the social media rubbish that was being published. And people would rather believe social media than believe the facts and science behind it. Now, everybody's got the right to determine for informed, but that's the point. They were not making informed decisions. They were making decisions based on gossip and perception.
Exactly.
So can we not do a campaign to rectify with MMR? Because as you can see, our children are suffering and not every one of them is going to survive.
Yeah, thank you, Yvonne. And I'm so sorry that you had to that you had measles, and I'm so glad that you survived it, and and are here to talk to us about it. Andrew Wakefield was struck off as a doctor. It was very much debunked, the things that he came up with, and he made, he caused so much damage, and it's a real shame. I think those of us who sort of work in health maybe think that everyone knows that he was struck off, that everything was debunked. I will take that as an action and share what we've got in our frequently asked questions, and sort of put the links of the details of how autism is absolutely, how all of that was debunked. So I can provide more information around that. If
Thank you.
Absolutely.
Thank you.
Thank you so much.
Thank you, Yvonne. I think Janice was next, and then Brian.
Oh, hi, Yvonne. Not Yvonne, sorry. I just wanted to know if the second MMR could be given before the 40 weeks.
That's a really good question and quite timely. I wasn't going to really talk about this, but they are thinking about bringing it forward. So in the immunization schedule that I was talking about earlier, we have them the two jabs at 12 months when the child turns 1, and then at 40. They're thinking about bringing MMR2 to 18 months. So that's a possibility, but that's not going to happen for at least a year. I think that the message I would want to put across is that it's very important to get that first jab in, because that first jab provides 95% protection. And then the second jab gives you up to 99, and then lifelong protection. So you don't have to get boosters, you don't have to, go back. Once you had that second one, you're done. So really, based on current evidence and how the data and the evidence are provided today, doing that first one at 12 months and that second one at 3 years and 4 months is the best way to protect children at the moment. And if you're an adult and you haven't had either, you can have both, and you can have them, I think it's a 2-month gap between MMR1 and MMR2. So if you're an adult or you haven't followed the schedule closely, you can have both jabs with about a 1 or 2 month gap in between the two. So you can be 99% protected within 2 months as an adult.
Thank you very much.
Thank you, Janice. Brian, did you lowered your hand, but do you still have your question, or was it answered?
I think it's been answered. Yeah. I think only just to say that I had an experience where when I was doing my nurse training in Sheffield, they did blood tests. This is over about 12 years ago. And they found that I didn't have some protection that I thought I had when I was younger. And I had to have new boosters because they felt, oh, you're at risk now. And I wonder if it's something that is common or something to worry about, because if I hadn't done the nurse training at that point, I wouldn't have found out about my situation, really.
Yeah, no, that's a really good question. So thank you so much for bringing that up. Everyone can absolutely call their GP practice and find out whether they've had the jab and if they're susceptible to measles. And if they are susceptible, they can go and get the jab. If you're not sure whether you've had it, the advice in the health circle is that you can get it. So basically, there's no harm to getting the MMR if you're unsure whether you've had it. So it's not something where you can overdose. So yes, please do check. So it's not just children that are getting measles, adults are also getting measles at the moment. So if you're not sure whether you've been protected, go to your GP and get that immunization at any age.
Thank you very much. And we have Sister Campbell next, and then we have also a question in the chat.
Okay, hi, good morning, Fumi, and everybody else who've joined us after I spoke. It's very interesting. It's literally a question, basically, because you said the outbreak is in Birmingham. My question here is there I like to go to the whys, basically. I like to find the root cause. So what exactly happened? Because in Birmingham, as a result, because we're looking at the outbreak now, so the immunization of young children, at what point were they not immunized for that outbreak to take place now? Is that as a result of the birth that has happened in Birmingham, or we're looking at immigration to Birmingham with the children who haven't been immunized from outside of our countries and coming in? Have we literally identified the root cause of the outbreak now?
Really, really good question. It's not one thing, it's several things, as these things tend to happen. So Birmingham is quite a young city, so we have more children in Birmingham. COVID caused this phenomenon that the World Health Organization described as vaccine fatigue. So we were all getting a jab, and then getting a booster, and then we needed another booster. And across the world, this phenomenon has been identified where people just thought, I'm not getting any more jabs. And people started thinking, oh, we need to give our bodies a rest. We need to give the children's bodies a rest, which might seem like a good idea, but actually it's not. And over the last, excuse me, over the last few years, we've seen that uptake rate. So I was talking at the start of the presentation about we need to see a 95% uptake to stop an outbreak happening. And in Birmingham and across the world, actually, the uptake rate for MMR vaccine has been going down, and that has been seen since COVID. And we do have newly arrived immigrants and asylum seekers, etc., who've arrived who might not have had that vaccination. But I think those numbers are so small compared to like the UK population. So the UK population ourselves, we're not getting our children jabbed at the right time. And it's also because people are living much more complicated lives. People might not be able to access their GPs, or they might not be able to take time off work, or they might have, a number of children and they just don't have that ability to just get them all in the car or on the bus or whatever it is to get them to the practice. Or the practice might say, oh, we've got a waiting list, so you're going to have to come back, whatever time in the future. So it's actually a very complicated set of circumstances that's led us to this current outbreak. But yeah, that's really just where we are. There's lots of things, but the key thing is if we get everybody up to 95% of the population vaccinated, we will end this outbreak and we will stop it. And the reason that it's 95% is there are people who genuinely can't have the vaccine. So people who are immunocompromised or have immune issues that can't get vaccinated, they would also be protected if that 95% was vaccinated. So I hope that helps.
Yeah, just to combat the response. Thank you so much for that. What can we do? What can, you know, as a church or as health professionals, because there has to be health promotions on this. And as we speak to people, we're aware that, you know, the change, the lifestyle change in people has to be from a mental aspect. Yes. So what can we do as individuals to encourage people to either take the vaccines? And I think Yvonne mentioned, and this is a very, very important, because when our generation was growing up, the vaccines were individualized, and there was no research that suggested there were implications of those vaccines. Is it a possibility, however, that we could just get them individualized again? It's just really trying to get people's mindset back into the trust from the health professionals. And then if anything, we can actually move from there. Is that something that we could do? Or if there's anything else that we can do, I would really welcome your input and advice on that. Thank you.
Thank you so much. I think what you can do, and what we're doing today is, I'm taking back any concerns that I'm hearing, taking it back, and then we're providing the right information. So the autism link and sort of debunking all of that. The triple vaccine is safe, very safe. I've had it, my kids have had it, you know, and I think that message where community leaders or faith leaders and people like yourselves are going through the community and saying, this thing is safe and you will protect your children and you will protect yourselves. I think that's what I would like from you, just to take those messages back and those health education messages. And as someone mentioned earlier, that information that hasn't hit the right level, where we might know, you know, in our team, because, you know, we do public health every day, where people don't realize that that thing has been debunked and that the triple vaccine is very safe, very effective. Just keeping that message going and then sending us back anything that you feel is an issue. So is it access? Is it that you would like, you know, a pop-up vaccination van to come to a particular site in Birmingham? Any of those things. And what I'm going to do is, Dr. Beatrice, I'm going to sort of link back with you. So I'm not here just for today, but I'm going to link back with you and send you all this information to share with colleagues and with the community, and also take back any concerns that people have. I think with the single vaccination, I think you can buy it privately, but it's not something that we're advising because we know that the MMR is safe. But I can take that question back to speak to my local NHS colleagues about whether people would feel better if they had that. But really, it's something where you're doing something knowing that you're sort of giving life to that myth, because it doesn't exist, you know, that it causes autism. But yeah, I will take that back though. Thank you.
Thank you very much. So just getting quickly to the chat. So I think Jennifer's question has been answered. What is the cause of the outbreak? And Fred asks, can we strengthen the immune system to lessen the impact of measles on the body? Well, we can, of course, strengthen our bodies through a healthy lifestyle, but eventually we will have to educate our immune system, and we cannot strengthen the immune system as much as we can strengthen our bodies to face the disease. But our immune system can only be educated, and education helps. Education of the immune system is either through infection, which is not great, but it's easiest through vaccination. I hope I answered this well for me. And the other question was, why don't we have vaccinations anymore in schools? We do get the flu shot, in schools.
That's a good question. So
what happens to the other questions? And after that, we'll have Mark, and then I think we can move on.
I'll just jump in really quickly about the schools. So we're actually undertaking a fast-paced piece of work with our local NHS colleagues where we're identifying 20 to 30 of the schools with the lowest immunization rates, because we've got that data, and we are going to go to them in February and March. So we're going to go to the schools, we're going to offer vaccination to absolutely all the children there who want to be vaccinated, and I think they're going to extend that offer to parents, teachers, maybe even the local community. So they are going to schools and they are offering the vaccination, absolutely. Yep.
Very good, thank you. Okay, Mark, you had your hand up as well.
Thank you. Good morning for me. Just a question regarding the debunking of the information from the health professional. Do you have any details that debunks the debunking, in a sense, really? Because what people will say to myself is, okay, then we've got this doctor's information is incorrect, but how have you debunked his information? They want evidence from ourselves, say, show us evidence, say his information is actually incorrect. And that'll give us ammunition to speak to people. Otherwise, we're going to go there, I'll say it's debunked, but what is the evidence you're presenting, Mark, to say it's being debunked?
Okay, I'll take that away and I will get the details. So we have compiled some frequently asked questions, and one of those, probably one of the most popular, is that autism link. So it will be
Correct,
there.
Yeah.
In great detail about how it's been debunked, but it certainly has. He was struck off as a medical doctor many years ago. He's left the UK. I think he lives in America now. He was struck off because what he said was a lie, and he was taking money off pharmaceutical companies. It couldn't have been more fraudulent or illegal what he did. So we can provide all those details and also provide the evidence of the studies that debunked it, and also the fact that we're all vaccinated and we haven't all got, autism is, a key piece of evidence that what he said was wrong. Yeah, thank you.
Great, thank you. Thank you.
Okay, and we have one more question by Yvonne.
Hi, it's not a question, it's just to answer Mark's answer. I got all my data from the British Medical Journal because I subscribe to quite a few, and I have some other articles if I can find them. It was a few years ago that I used them, but I can still find some of them now. If you go on the website, that you can find a lot of information. Some of it's very detailed, very analytical, but you can still pick out the key information. What was it he accused it of or claimed he found, and what they discovered. So there's quite a few articles, and just make sure you check your references, like all research, to make sure
that's important.
Credible. Yeah. Okay. I hope that's
BMJ. And the BMJ you're saying? The
BMJ, it'll only take you so far because you need to subscribe, but the main information you need is there. But also look at other credible websites like the NHS, like the Department of Health of old, and some of them are archived because they've now changed their names. So do have a look, and whatever article you find, like all good research, cross-reference their reference. So it's not Wikipedia or Bible or study.com. It is actual scientifically verified information. So I hope that helps.
And I'll share what we've got.
Thank you.
Yeah, okay.
Thank you.
All right, thank you everybody for the input. Before we move on, I just need to leave you with one last comment. Our Adventist Church is a world church. It's a global church all over the world, and the headquarters are in Maryland, very close to Washington, D.C. as well. And our General Conference Health Department, they do support responsible immunization and leave it as a personal choice. So obviously we're not pushing anybody into it, but we're strongly recommending getting vaccinated. Unfortunately, as in every faith group and in every community, there are also some that are against vaccinations, and they are unfortunately very vocal. And because they have great influence with their followers as well, they have done a lot of damage over the years. But this is the message to all health officers here. It's always good to check back with the official statements of our church, because those are definitely fact-checked. We have very good scientists and doctors working in the health department, supporting the health department. So it's best to always check with the official statements rather than statements of individuals who may be affiliated with the church. So this is just the very important thing I want you to take away on the vaccination issue. And now I want to say a very big thank you to Funmi for joining us so spontaneously at such short notice. But it was great having you, and thank you also for giving very detailed and very good answers. And we will certainly stay in touch on this issue.
Thank you so much for your time. It's been a real pleasure. So thank you, Dr. Beatrice. I will keep in touch. Thank you so much, everyone. Take care. Bye.
Thank you. Bye-bye. All right. So I hope you could take away something great here. And I mean, this was an experiment to invite non-Adventists to our officer training. But again, I think it is important to keep our eyes open, because what did Jesus say? We are in the world. We're not of the world. But it doesn't mean that we shouldn't be in the world, but we need to know what is happening around us. And in the end, what we want to achieve is optimal health for everybody, and what leads to that. So I just want to thank you for being very welcoming, for really sharing your interest as well, and for making very good comments and asking very good and very important questions. I really appreciate your hospitality here and your patience. That is just wonderful to me. Oh, that's the wrong slide. I mean to go back to our own presentation. So thank you again. We're going to take a tiny little break soon, but of course it's going to be a break with it's going to be a working break. So let's see where that takes us. No, that's still not it. Yeah, that's my beautiful desktop background. Aha, there we are. I hope you can see my screen. Okay, so we have again our wonderful resources of Adventist Health Ministries. There's going to be a leaders page. You can register as well at the official Adventist Health Ministries page as a health ministries leader, where lots and lots of resources are available to you for free. So let's continue with our community assessment. So right now, we just had a community assessment done right in front of our eyes, and that is wonderful to see how these things work. We actually look around our neighborhood and see what is happening. While Funmi was presenting, I was actually looking up Manchester, because I'm based in Manchester, and of course I'm worried. And it turns out that the main outbreak is in Bury. So this is something to take away. Maybe our churches in our soup kitchen in Bury wants to spread some information here and help prevent a larger outbreak. Now, the community assessment, as I said before, is called JSNA, Joint Strategic Needs Assessment. And you know what? That exists for every single city and town in the UK. You can look it up. All you have to do is Google JSNA and your town, and you can do a little bit more clicking of that, and you get to that. I will share with you a live assessment later on, but this is where you can find a lot of data, because what better project or program you can develop that's based on data. Unfortunately, a lot of our programs are based on assumptions, and that is not a great way to start a program, because it needs to be relevant to the community. So I would like you to take a little break, and we can do a little Google break, so to say. And you can just Google your JSNA for your own city. And I'll give you 5 minutes, and then we can just discuss a little bit what you have found out, what is happening, and what's the demographic, and what does your population in your neighborhood, in your city look like. So I will stop sharing now, and I will find JSNA I wanted to share with you later. So just type in JSNA and your city into Google, and in 5 minutes we will reconvene, and then you can let me know what you have found out. the recording. And let us also continue with our presentation. We're almost done. We just have a little bit to go. Hold on, this is not what I wanted to share. And here we are. So we did look up the JSNA for your various cities. You found interesting statistics, sometimes unexpected statistics. And so it is important to understand what we're actually doing in our communities, where we are placed, and how we can make a difference there. Again, our main motivation for doing what we're doing is the Great Commission, and the health message is the entering wedge to actually be able to address every community who needs Jesus. Now, lastly, what I want to encourage you to do is to really think it through, to know what you're doing. Okay, it is important. Health message, health programs, health presentations, health expos are a great way to engage with your communities, to do what you're called to do, what you've been elected to do. But everything has to follow a certain logic. And here's where I want to introduce you to the logic model. It is a bit complicated, but it doesn't need to be super complicated. It just encourages you to be a little bit more organized and thoughtful about all your strategies. And that doesn't mean that you can't do and realize any of your great ideas, but you actually go about it in a very logical and organized way. Because if you fail to plan, you plan to fail. And the logic model is one of the safest ways to prevent that. So what is the logic model? It talks about very important terms here, like impact, outcomes, inputs, outputs, and evaluation. Of course, the impact is the most important one. We do want to transform our communities. We want to shine a light where we are. We want to lead people to Jesus. We want to create disciples. That's the impact we're talking about. Of course, we can say, well, our impact was that we have reached so and so many people. That's a good impact, but it is not the end result. The end result is always people with Jesus, disciples. That is the impact where we're aiming at. And you know what? Yes, aim high, aim high. That is what we're trying to do. And of course, there is no trying, but there's just doing. Now, the outcomes are the disciples. This is what we want to do. People who have come to Jesus. Now, what do we put in any project, in any program? We put in our resources, which is money, brochures, literature, expo kits, time, but it can also be volunteers and time of the volunteers and your team. And the activities, finally, are health expo, family life seminars, grief recovery programs. Anything that you find will have the desired impact. Our outputs are not the same as our outcomes. Okay, outputs are how many flyers we have dropped, how many posters we have put up, how many books we have given out. Outputs are just the dry data. Outputs are how many people have come through our doors at the expo. So anytime you have a health expo, I would always appreciate a little report that says we had so and so many visitors, so and so many visitors of the age of over 18, for example. This is a valuable statistic. But that is not an outcome. That's not an impact. That is an output. So please send me those reports. They're important. But of course, it's important that we follow up with the people that come through our door. And of course, a very, very important one is the evaluation. Without evaluation, we might not even start, because from the beginning, we need to think and rectify what we're doing and just always evaluate, are we on the right track? And having had just our discussion about the JSNA, that is a big part of evaluation. What we're planning to do, does that actually meet the needs of the communities we want to reach? Now, a logical framework example could be this. This is what it kind of could look like, okay? So you put the context in, the inputs, volunteers, etc. The activities are just a tiny part of the whole process, okay? The outputs and the outcomes. Here are the external factors. External factors are important because, for example, you're holding a health expo in the park. An external factor is a factor you cannot control, and that is typically the weather. If it rains, it's an external factor that you can't control, but you have to calculate for it. So, of course, you prepare for that as well. So, you maybe want to bring along a gazebo or a marquee so that if it rains, you can still hold the expo and you don't have to call it all off. External factors are other things as well, traffic, parking facilities. So always factor those in. And the assumptions, again, we're hoping that the people are interested in our health message. And of course, our community assessments also go into these assumptions, okay? So this is where our homework comes in. So without the context and the priorities, doing our community assessment, we can't do any of this. This is the beginning of everything. And of course, the evaluation plan is ongoing. We evaluate our communities, we evaluate the baseline data that we've collected, the attendance data, the follow-up assessment, and of course, the outcome. Now for our NHS project, which we won recently, this is what the log frame looked like. And yes, there's a lot of stuff in there, and I do not expect any of that from you, of course, but just so you have an idea that this is how this is planned. And if you could just think about those terms in whatever you're planning, it will already help you a great deal to really pull this off with maximum impact and with minimum risk. Just have it in your head that this is what it looks like. Of course, we had a great time already. So the project that we're running right now, where we're paid for resources and literature and venues, that has already been ongoing. And I want to share with you 2 health expos that had really a great impact as well. And I know many of you have already run your expos, and I've been to many, and I've been so blessed and so touched how wonderful and professional they were actually put together. And I'm really, really impressed by the health ministry's work that is happening right now in our churches. But I do have video footage of 2 expos that have happened recently, and I just want to share them with you right now. Now, I do hope that you can hear the sound. So this was a little bit of the presentation from Chester. I can tell you more. What I loved about the Chester Expo was the fact that it was in the town hall. And you know what? Yes, it was there we go. You know what? The bravest thing that Chester achieved was that they actually had their first expo in a public place. So even though it was the first, they were not timid about it. No, they said, no, let's do this and let's do it the right way. And they rented the town hall, the public place, to go where people are. And, you know, I'm telling you, it was a rainy day. It was a terrible day. And I thought nobody will come. And I gave a big speech at the beginning. I said, you know what? Even if one person comes to the expo, you know, everybody, you know, in the heavens rejoices for this one sinner who turns around. So I said, we need to rejoice for even one visitor. And you know what? They had almost 100 visitors who came that day through the town hall doors. So I just encourage you to be brave about this and to really go for it and to go where the people are. Of course, we want to invite people to church and to come to church for the follow-up, but we have to get to them in the communities. And I want to share with you another expo that happened on the 16th of December, and that was a Mega Health Expo. That was the Mega Health Expo that happened in Manchester Piccadilly Church. And you know what? There were plenty of challenges there. It was a rented place. Manchester Piccadilly rent the venue. They do not have their own church yet. And you know what? It was still such a blessing. And do you know how many visitors we had? 600 visitors came that day, because, you know, the organizers had made so many connections. We had sponsors from many different entities, the British Liver Fund, the Blood Donation Service, Female Health, many different ones. And very important, there was a vaccination truck parked in the parking lot, and many flu jabs and COVID jabs were given that day. So it was wonderful to see the collaboration with the community. So I just want to share that video with you as well. Whoops, just, okay, probably that is not working. Hold on, then I will have to share with you the video on YouTube. Just bear with me. Just bear with me a little bit. So basically, this wonderful expo was just a very special blessing for everyone. Okay, so now I just need to share again. The advanced video.
This Mega Health Expo idea came into mind. And there were so many different agencies, so many different organizations.
From a service perspective, I feel like there's a lot more that we could be doing within our community.
It is my prayer that it will continue and we will do it regularly.
Manchester Piccadilly Church, a mega health expo event. What a day it was. Over 600 people walked through the doors, including volunteers, including community services ambassadors. We had so many sponsors, so many participants. It was wonderful to watch. A real community outreach event. The way we need to engage with our communities has become real today. Outreach is the most beautiful and the most meaningful activity a church can offer, including communities, and giving them the most important message, the gospel message, together with the health message. Spreading hope, spreading life, and spreading spiritual health along with mental and physical health. I'm so proud to have been here today. It was a full day. It was a busy day. It was an exhausting day, and I'm sure everybody is tired, but also inspired. This was a wonderful event, and I do hope there are many more to come. This is what we do. I'm proud to be an Adventist today and to have seen outreach in action. All right, so this was the Manchester Health Expo in Piccadilly that just happened not such a while back. And it was just wonderful to see how these things actually came to pass. Because, you know, again, very brave, the whole church. It was the first expo, and they said, you know what, for our first expo, let's go mega. Let's not just, you know, be timid, but, you know, let's get out there. And this is something that I want to really encourage you as well to do, is find sponsors, find collaboration. So, for example, in Manchester Piccadilly, the collaboration was with the Manchester Local Care Organization, the BHA for Equality, the British Liver Trust, Social Prescribers, Citizens Advice, Kings and Queens Give Blood, and Vocal. Now, when you mentioned earlier, it is difficult to reach certain communities. Well, find organizations who do and collaborate, because those organizations that work specifically with refugees and migrants, for example, you can just invite them in. Many of those organizations would love some collaboration because they need a space. They need to have a place where people can come to, which is safe and which can be a trusted environment. So always be brave and seek collaboration with others. I want to continue just a tiny little bit and give you a few more dates that are going to happen before we wrap the session up. Yes, Bolton SDA Church, again, very brave. The first diabetes reversal course ever, and they're going big. It's going to be a 3-week program with diabetes info lectures, exercise, cooking classes, and of course, our wonderful, precious volunteers from their own congregation. This is a revolutionary program that we've done for many years, which can actually reverse lifestyle disease. If you're interested in running this program in your church, please contact me. I will provide you with the resources. Now, another date that you need to keep in mind is more action. Yes, we hit the ground running. It's the second month of the year, and right after officer training, in 2 weeks' time, we're going to have a large expo at the Birmingham Library. Again, a public place where people are, where we have many young people walking through our doors to reach them. And we still need volunteers. So if you're in the area, if you have a good church team that is interested in learning by doing, encourage them and join us at the Health Expo in the Birmingham Library on the 10th of February. Now, the 10th of February is going to be Forward We Go Day. That's the day when our leadership and our colleagues and sponsors and other departmental directors are going to be in the Birmingham area, in Area 5. So this is a chance for you to shine and to show how health ministries can be action. Because, of course, on such a Forward We Go Day, on a special health day, this is not a time to sit indoors and to listen to a presentation, but this is to go out and to share the gospel. And I'm very proud that we have found this space, and I'm very grateful for the wonderful team of Handsworth Church and of Camp Hill Church who made this possible. So this is something that you definitely should put in your diaries. Which other programs can you run? Because every expo is only as good as its follow-up. If you're interested in running a year-long presentation, topical health program, I can only recommend Celebrations. It is not great for an expo, but it's great for different year-long programs and for getting in touch with young people. Then, of course, we have Breathe Free, very relevant for anybody who would like to quit smoking. Breathe Free is open source. It is completely free. You can get all the information and all the resources online. You just have to register as a facilitator. There's training as well. So please, if you do want to run a smoking cessation program in your church, it's the easiest of all. Do a Breathe Free. Then, of course, yes, alcoholism. We heard about this earlier. There was a JSNA statistic there. We have our own Adventist Recovery Ministries that offer a 12-step program. 12 steps are very similar to the AA, to the Alcoholics Anonymous. However, it is not just for or only for addiction recovery, but it is also for trauma recovery and for conflict recovery. So the 12-step program is something I could only recommend. It will transform churches, it will transform lives, it will transform whole communities. So I would definitely recommend running the 12-step program. Now, the 12-step program is very special this year because we have just been given the green light to print all the books, all the participant books and all the facilitator books for every church who would like to run it. And we are going to have our own Katja Reinert from the General Conference to come and, whoops, and of course that is not working. So our own Katja Reinert from the General Conference is going to join us for this wonderful program, and we're going to have a health retreat that is happening in July, 19th to 21st July. And let me see if this one works. There we go. So we're going to have a health retreat with Katja Reinert to come and join us for our facilitator training to run Journey to Wholeness programs, the 12-step program in your churches. This is a very important retreat because we're going to have the attention of the General Conference, and I can only encourage you to save the date and to come and join us for this wonderful weekend. It's going to be a weekend which is intense, but it's going to be in beautiful grounds. We've chosen a very, very nice space to do this, and I think everybody will come away blessed and everybody will come away inspired. Finally, because we're going to run out of time a little bit. Gosh, how time flies when you're having a good time. Finally, we do need people and volunteers at all times. We need educators, we need trainers of trainers. So if you are interested in giving training, how to run health programs, if you want to share your expertise, because obviously I've gotten to know you now, you're very knowledgeable already in everything you're doing, then please share your knowledge. So I would love to put you into our team of health educators and trainer of trainers. This is desperately what we need. Finally, I want to give you thanks because it is wonderful to see your passion and your interest in health ministries, and I'm just so blessed and so happy to have you part of my team. And I want to close with this wonderful quote by Ellen White when she said, "To have perfect health, our hearts must be filled with love and hope and joy in the Lord." And this is what we saw today. This is what I could see in you, the love and the hope and the joy in the Lord that we do want to communicate to the communities where we're planted. So thank you very much for your attention. I know it was an intense program. Again, the recording will be made available to you, and handouts and presentations. So please just let me know what you need. I will put my email address also in the chat. You can email me at any time, and if you call the NEC office, they will patch you through, and we can talk on the phone as well. So thank you very much. I will stop recording now, and then we can discuss if there are any more questions.